Treatment or the management?
So the management is number one. If you can determine what your trigger is, then we want you to avoid it. When it comes to foods, we want to make sure that we eliminate what it is that could be the cause, but we also need to supplement that child's diet. And sometimes that's the harder part. For children who have severe or moderate cow milk allergy, they require certain formulas which are not actually sold in the shops, regardless of how they are written HA. Those are not the formulas we use for treatment. These are specific medications that are prescribed for these children, and they're usually bought at the pharmacy. Because we need to make sure that this child is able to grow and thrive.
Just to interrupt, is removing milk, cow milk to be specific, from the diet a possibility? And would you supplement with for example, like plant proteins?
So, for example, yes, for those ones who have cow milk allergy, we do remove it. And then it also depends again, it's a bit complicated. If you're having an immediate type allergy, all right, then we will completely remove the milk from your diet. If you have what we call delayed reactions, then you might be able to maybe tolerate yogurt, but you can't tolerate fresh milk or packet milk. So it depends on how that child is. When it comes to substitution, like we said, we usually use what we call hypoallergenic formula milks. Sometimes you're forced to use camel milk. The thing about camel milk is that it is not as nutritious, so therefore I can't give it to certain ages. There are formulas in the market like rice formula. These days we have oat milk, we have almond milk. So these days we have a lot more alternatives.
Looking at our society today, and even given the recent COVID-19 pandemic, there's an inclination of people opting to explore natural remedies. Is this a possibility when managing allergies?
First and foremost, we have to find out what natural remedies are.
Okay.
To be honest, some of the medications we use, we found it because we were growing mold on a petri dish by mistake. The thing about natural remedies, number one, what is it? How does it work? How much do you need to use it? And since I don't have any evidence for that, I usually don't advocate for it.
Okay.
Yeah.
Recently, looking at studies from the US, the UK and Canada, they have advocated at science looking at a closer look at the first poop or stool from a child, this is meconium, to be an indication of possible allergies that a child may have. What's the application of this kind of research in Kenya today?
We have not started conducting those studies here, mainly because we don't have those tests available. So if we were to do that, it would mean collecting samples and sending them abroad. That is information that we've had for quite a while, to be honest. What they're looking at is we have organisms that live within your guts. They actually live on your skin. They are in your airway. So what they were looking at is what type of those organisms do we have, and compared them among those ones who developed allergies later at 1 year and those ones who didn't. And they found a certain panel that is more predictive of allergy development in a certain population. It is also, we can also be able to predict which child is going to develop allergies, even by your history. If you come from a family of people like mine, where we are very atopic, which means we can develop all allergies, then the risk of our children developing allergies is higher.
It's higher.
If you have a sibling who has an allergy of one kind or the other, you also have a higher risk. If you're living in Nairobi compared to somebody who's living in the village, you have a higher risk. Why? Because the environment is changing our DNA. And it is predisposing people who didn't have any family history to now developing allergies in later life.
Look, today, as we draw an end to this interview, do we have allergies more common, or has awareness increased? And if it is common, then what's the prevalence in our society today?
Allergies are actually increasing worldwide. That's a fact. We even have studies that have shown, 10-year studies that have shown that asthma, allergic rhinitis has increased. In terms of prevalence, we do not have any population-based studies as of right now. Those are studies that we are thinking of undertaking to determine what the prevalence of these different allergies are. You had asked me a question also about management, and I'd like to tell those parents of children who have asthma, who have rhinitis, that apart from trying to avoid your triggers, is to make sure that we decrease the inflammation. And you decrease the inflammation by making sure you use your controllers every day. And you have a specific controller for your nose, you have a specific controller for your chest, and these are usually steroids. And these are steroids that we give only for that particular area, like the intranasal spray or your inhaler for the chest. And in that way, we are giving you very small doses that is able to control your inflammation for a long period of time. If you don't do that, the inflammation continues and it can actually change your child's airway, and that might have an effect in later life.
Thank you so much. Probably closing words to that parent, that guardian, teacher, in recognizing and managing, allergies. That, quick 3 from an allergy specialist.
If you think that your child is having a problem with a particular food, what I'd actually advise them is to come and be seen. The reason for that is that there are too many ways in which food allergy presents. And there are also other more common causes of those things, like diarrhea, infective diarrhea, okay? So we'd rather actually make sure that we confirm that diagnosis before we manipulate the diet so that this child can grow. Because once you start eliminating food from that diet, some children never agree to eat them again because they already understand, Mommy told me egg is bad for me. You can't get them to eat that food again, and they need it. So especially for food allergies, see your doctor. Come and see the allergy specialist so that we can make sure your child grows and grows well.
Thank you. We really appreciate, and we look forward to having more interactive sessions with you.
Thank you very much, and thank you for your time.
Thank you.